So hello everyone and welcome to today's session. Thank you for joining us. My name's Sabiha Kazal and I'm part of the Kazan National Office staff. Kazan respectfully acknowledges that its national office is located on the traditional unceded territory of the Algonquin people. Before we begin, I'm going to go over a couple of housekeeping items. So as mentioned, today's session will be recorded. It will begin with a presentation from our speakers, followed by some time for discussion and questions. I know that our presenters are really looking forward to hearing from the audience. So to engage in the conversation, just press the raise hand button. And once we call on you, you can unmute yourself and ask your question. You can also ask questions using the comment box, and we just ask that you do not unmute yourself unless you are called upon to ask a question or speak. And I'll pass it on now to Nancy, who is the chair of the Kazan Mental Health Interest Group.
Thank you, Sabaya, and welcome everyone. My name is Nancy Clark, and I also would like to acknowledge with respect that I'm attending today's webinar from the University of Victoria, which stands on the Songhees, Esquimalt, and Wasanich-speaking peoples, and whose relationship with the land continues to this day. As Sabaya said, I am a member of the Kazan Mental Health Interest Group, and this is a nurse educator interest group where we provide a forum for educators to share ideas and collaborate with colleagues across the country on a topic area that's of interest to them in mental health and education. If you're interested in joining this group, you can get in touch with Sabaya, who emailed you in the link that you were sent for this webinar today, the CNEI website. Now it's my pleasure to introduce our panel moderator, Dr. Charlotte Ross, who's also a member of the Kazan Mental Health Interest Group and is a faculty member in the BSN program at Douglas College in Coquitlam, British Columbia. Thank you.
Thank you, Nancy, and thank you all very much for joining us today. I'd like to begin by respectfully recognizing and acknowledging that the Douglas College Coquitlam campus and my own home are situated on traditional and unceded territories of the Coquitlam and Coast Salish First Nations. It is on these lands that we live, we learn, we play, and we do our work. So I'd like to welcome you all to today's panel presentation by the Douglas College BSN Peer Mentorship Program. Experiences of a BSN Peer Mentorship Program in enhancing students' mental health during the COVID-19 pandemic. So we have with us today a panel of student representatives of the Douglas College BSN Peer Mentorship Program, who will discuss their experiences and the positive mental health impacts of a student-led support group for fellow nursing students. I'd like to open the presentation by introducing Mackenzie Lister. Mackenzie Lister is the Learning Community Coordinator in the BSN program at Douglas College. She is the faculty member responsible for supporting the peer mentorship group. Mackenzie.
Thank you, Charlotte, for that welcome. I also want to acknowledge that I'm from the East Coast, so I was born and raised on the traditional and unceded territories of the Passamaquoddy, Mi'kmaq, and Maliseet First Nations, and I currently reside in Langley on the Stalo First Nations, and this is where I live and I raise my family. So today I have a very exciting presentation put on by these students, and I want to introduce them to you all. So we have Anise Sim, Quinn Galilee Lang, Bahar Fakhri, Megan Scott, Jen Tong, who are all in the final year of their nursing program. And I also have Jessie Sanderson and Allison Guia, who are in the second from their final year. So I know they're eager to come on, so I will pass it over to them now. Thank you.
Hello, everyone, and thank you for attending our presentation on the experiences of a Bachelor of Science in Nursing students peer mentorship program in enhancing students' mental health during the COVID-19 pandemic. We would like to start with an Indigenous acknowledgement. We would like to acknowledge that at Douglas College, we live, learn, work, and play on the unceded traditional territories of the Coast Salish people of the Cookite and Coquitlam First Nations. Today, we are presenting remotely from the unceded traditional territories of the Coast Salish peoples of the Coquitlam, Katzie, Musqueam, Squamish, Tsleil-Waututh, Semiahmoo, and Kwantlen First Nations. Now, Megan will talk a little bit about the history of PMP.
Thanks, Anis. So PMP, which stands for Peer Mentorship Program, is a Douglas College nursing student-led group. Together, we collaborate to provide and create a safe space for students in the nursing program to share their experiences, thoughts, and challenges throughout the entirety of their time in the program. Students from all semesters share their experiences, ask questions, while simultaneously building a community and making connections that will support them throughout their nursing career. Back in 2010, Priya Rideout, a Douglas College nursing alumni and current Douglas College faculty member, recognized that students were withdrawing from the program and not passing. At the same time, students were wanting to feel more connected and hear from their senior peers about their lived experiences within the nursing program. They also wanted a sense of community and belonging within the program, just to feel connected to their cohorts. Unfortunately, the operational delivery of our program at this time did not afford us many opportunities to engage and socialize with our fellow nursing students. Students were really looking for more than just being told, it's okay, you'll be fine, just read 100 pages of Potter and Perry. In hopes of filling this gap, Priya approached Heather Jensen, another Douglas College faculty member, and the rest is history. I'll now pass it on to Bahar, who will tell you a little bit about the legacy of PMP coordinators.
Thank you. So senior PMP coordinators who were in their last semester of nursing school would pass down their roles to junior nursing students who wanted to take over their roles and because they were interested. So the idea is that they took their time to explain their responsibilities to help us transitions into this new roles. I remember a senior PMP coordinator explained and showed me a tutorial of our website when it was time for her to graduate, so it was for me to take over. We also have a handbook that was created by PMP alumni. This handbook is frequently being updated with the rapidly changing educational environment in nursing and as we adapt our meetings and operations to COVID restrictions. Now I will pass on to Anis, who will talk about how we run PMP before COVID.
So we had weekly meetings in person during our lunch hour in between classes, and just like our online meetings, everyone was free to attend with their lunch at any time during this hour, and some meetings were scheduled with a predetermined topic of discussion, such as pharmacology, study tips, and other academic-based sessions. There are other open format sessions where we would eat lunches together and chat about anything the students wanted to or were struggling with. And to ensure conversations remain professional and on topic, at least one coordinator would volunteer to moderate these meetings. We also held events such as raffles in the common area at least once a semester to promote other BSN students to join PMP. Guest speakers were also invited to speak at some of our meetings. And finally, we had wrap-up parties at the end of each semester with food where any BSN student was free to join. And next, Bahar will talk a little bit about the simulation.
So with assistance and support from nursing faculty and simulation technicians, PMP coordinators would organize a clinical scenario for nursing students from all semesters. It allowed them to come together and observe the clinical simulation where the senior PMP coordinators would volunteer to play roles of the healthcare team. So during the sim, one coordinator would stay in the room with the observers where they would be asked what necessary assessments have to be completed, and of course we assisted them if they needed any help. So we would have pre-sim and post-sim discussions. This benefited students by exposing them to more practice with simulations, increased exposure to different assessment styles, learning opportunities of what went well and how to improve next time. Another benefit of multi-semester simulation exercise is that students learn from and through each other. Now I will pass on to Quinn, who will talk about how we helped students.
So what were we doing to help students before the switch to distance learning? We provided support and advice as leaders within the program, both on an individual and group basis. Nursing students of all ages and semesters would come to our weekly sessions and ask us to share our study tips for a particular class, or how we deal with preclinical anxiety, how we found a particular skills test, or even how to muster the courage to talk to their very first patient. We would also hold welcome tables to spread the word of our program. We would often wave to familiar faces we see on campus and focus on helping others to feel more connected to the program and building a supportive community. We host group counseling sessions with the Douglas College counselors, also using opportunities to promote individual counseling sessions if they're interested. As PMP coordinators, we encourage others to reach out or stay after the meeting if they were going through a hard time and wanted to talk to someone who understands the demands of a BSN program and the effects it can have on mental health, personal relationships, and physical health. As leaders of this group, we would make a point to make ourselves available to chat in the hallways or would wave hi in passing. We would recognize people that had attended previous meetings and ask them how the exam they were stressed about went last week, or ask them how clinical is going for them. Being from senior semesters gives us a great insight into what they might be feeling overwhelmed about at the moment and gives us a conversation starter to see how they're coping in the program. We try to always be opening and welcoming when we're on campus. I remember going up to one of the PMP coordinators as a semester 1 student before I became a coordinator myself and asked her what her tips were for a final exam I had coming up. She was studying with a few of her semester 4 peers, and I felt comfortable talking to her because I recognized her from seeing her speak out at PMP meetings. She invited me to bring up a chair, and she and her friends sat and talked with me about how they found the exam and their tips on what to focus on. She gave me really useful tips that helped relieve my anxiety, and I was grateful for how the whole group were interested in offering me tips to do well. I felt really supported, and they seemed to really want me to succeed. The current coordinators of PMP all share the same values that she showed me that day. We know that these junior students are going through academically, and we want to be there for them and show them that it is possible to get through this program and that they have a team of people rooting for them to succeed. So now I'm going to pass it on to Jessie to talk about how we've adjusted our practices to the pandemic.
Thanks, Quinn. So COVID-19 has impacted the way our PMP meetings are currently run. We still hold weekly meetings on Tuesdays during lunch, but we shifted to an online format to accommodate life in the pandemic. We use Blackboard Collaborative, which is the same platform used during classes to make it easier for PMP members and nursing students to enter our online room. We also advertise our meetings on the BSN communication board, which allows for nursing students to get notifications about our meeting day, time, and our topic that will be discussed for that meeting, which replaces the normal posters we usually have in the hallways. We also have a WhatsApp group for PMP members where we communicate events that are posted on the BSN communication board, as we learned that most students actually don't check the discussion forum frequently. As PMP coordinators, we have also collaborated with semester 1 and 2 nursing faculty teachers so we can join their virtual class at the last 5-10 minutes to remind students about our sessions and what they can expect during our meetings. We also allow for any questions that the nursing students may have, as some of them never heard about PMP before. We also remind nursing students and members that we have a website where they can access a PDF of our schedule of our sessions and the different topics that we'll be talking about during our meetings. We also have various information sessions where we have special guests to address specific topics for our PMP members. For example, we teamed up with the PMP group from the psychiatric nursing program at Douglas, and they gave our BSN PMP members insight about their program and the patients that they may see. This was really beneficial for our PMP members, as we're going to be going into or who are currently in their semester 4, which is our mental health rotation in the nursing program. And then we have greatly utilized the WhatsApp group during the pandemic. It is a fast and easy way to address quick questions and to communicate reminders of any current events. We also encourage our PMP members to reach out to PMP coordinators privately through WhatsApp or through our PMP email. This allows for the PMP members to share concerns or ask questions that they may have, but feel more comfortable sharing things on a one-on-one setting and knowing that it's not being shared within the whole PMP group.
We provide support and advice as PMP coordinators, both on an individual and group basis. We also collaborate with Mackenzie Lister, who is our learning community coordinator. We direct students her way when students bring up issues that are beyond the scope of the peer mentorship program. Mackenzie also directs us to resources that will be beneficial for common issues students face and meeting topic recommendations, as well as supporting coordination of guest speakers. To illustrate how we work collaboratively to support students, I would like to share with you two student stories. The names have been changed for privacy reasons. The first story is Hannah's story. We received an email from a first semester student who was looking for support as a mature student because she said she was feeling like an oddball. Because she was older than the other students and was struggling to make connection while doing school online. We recommended attending PMP sessions, connecting with a PMP coordinator, and considering counseling if she was still struggling. The student was connected with myself as another mature student. I connected with her via email and WhatsApp Messenger, and we discussed strategies for studying as she was feeling overwhelmed with pharmacology. I also connected her with other mature students that I knew in the program and encouraged her to attend our weekly PMP sessions, which she did. Hannah expressed appreciation frequently for the support that PMP has provided for her. Later in the semester, she felt like she was struggling academically, so I referred her to Mackenzie for support and recommendations for learning opportunities over the summer break. The next story is Amrita's story. At our first semester after school special that we run each semester, there was a student who was already feeling very overwhelmed. We added her to the PMP group WhatsApp chat, and it became quickly clear that she was struggling. She attended the weekly meetings, but it seemed like she required more support, so I reached out to her to offer support and study tips. After talking with her, I realized she needed support beyond what I could offer. I referred her to Mackenzie for academic support, and as a result of her struggles and the struggles of other students who had begun their nursing school studies online, we realized we needed to offer more resources and began to investigate how we could accomplish that. Now I'll hand this over to Bahar to speak about what has changed with PMP since the pandemic.
So sims are now virtual sims because we could no longer run the simulations during online learning. The college provided access to virtual simulation scenarios for students. As one of the coordinators for PMP is also a voting student member of the BSN department's Curriculum and Program Evaluation Committee, you were able to advocate for the resource to be available for students going on forward as well. The shift from focusing on academic support went to emotional support because feeling connected, so we can feel connected in the program. While academics are still a major topic of interest, we do a lot more check-ins and have students are coping mentally because we know from personal experience that they'll be feeling isolated and disconnected from their learning journey. As for Indigenous Acknowledgement, it has been added to our shifts to online. In our weekly meetings, we will incorporate it at the beginning of each meeting. After learning about cultural humility at school, we, a PMP coordinator, suggested that doing the Indigenous Acknowledgement is a way we can build toward a community that is culturally safe and aware of Indigenous realities. It's an important action towards creating reconciliation with our community, within our community. The PMP coordinators also liaise with our regulatory and professional bodies, where we would hold events such as our popular employed student nurse information session. Now I will pass on to Jen.
From the Peer Mentorship Program, we launched another club called the Douglas College Student Union Health Sciences Journal Club. In this club, we discuss academic journal articles on a variety of healthcare-related topics. I recall during our last in-person session before COVID-19 moved our sessions online, one of the members made a comment about removing her children from childcare so that they would not be exposed to the Chinese children that also attended her childcare center. This broke my heart as a mother of two half-Chinese children who were already experiencing discrimination at their own daycare. We immediately addressed this comment, and the student graciously retracted her comment and apologized. However, this led us to delve further into systemic racism and inequities within healthcare. Recent journal club topics have included growing cultural humility in the healthcare profession, racial bias in pain assessment and treatment, and food insecurity in rural Indigenous communities. We also have a continuing focus on mental health in nursing, and our next session will focus on LGBTQ LGBTQIA2S+. Now I will pass it on to Megan, who will discuss how students benefit from the peer mentorship program.
Thanks, Jen. So yeah, students benefit from PMP in so many different ways. We're able to assist students by referring them to appropriate support persons. So as mentioned before, Mackenzie, and then we can also connect them to necessary support. So counseling, or maybe they need some study tips from the Learning Center. We also connect students to appropriate or relevant mentors to their specific challenges in times when a coordinator may have experienced the same challenge or something similar. So similar to Jen's previous example of the mature student. As students, we have now switched to online class format, and we found that students seem to be even more anxious than what we had seen in the past. To help students navigate, we encourage students to contact us privately through our email or group chat to address specific problems that we may be having. To cope with isolation, us PMP coordinators ensure that our cameras are always on so that students can see some friendly faces. We have also been increasing our reach out efforts by posting more frequently in our BSN communication boards and popping into virtual classes to remind students about what we do and that we're here to support. We also have our WhatsApp group chat, and that's very easily accessible for students, and we try to be available as possible on there as well. Ultimately, PMP creates a sense of community, a support system, and it really just gives students a shoulder to cry on. PMP also allows students to connect with each other, as newer students have struggled to make connections with classes being online. In a group setting, students benefit because senior students are able to provide support and share their own lived experiences with how they were able to overcome the challenges of nursing school. This has been further shown to reduce anxiety in students as they feel more prepared for the academic and emotional demands of each semester. Support has increased significantly during the pandemic as we continue to find ways to help and support students during these challenging times. So now I'll pass it on to Allison, who will give you some insight on how and what we're doing to support mental health.
Thanks, Megan. So in order to support mental health, especially during the current COVID-19 pandemic, we have continued to implement monthly counseling sessions facilitated by our Douglas College counselors, which include guided meditation, mindfulness activities, healthy coping, and self-care strategies. In addition, we continue to encourage open conversations about mental health, both academic and emotional challenges, and voicing the need for support through creating an open, non-judgmental, and supportive environment during our weekly online meetings, as well as through your emails and PMP group chat. As PMP coordinators, we do our best to lead by example by being open with our own challenges, which benefits our own mental health, as well as provides an opportunity for our peers to see that they're not alone in their struggles. And so now I'd like to share my personal experience with how PMP has been a massive support system for me in my mental health. So prior to being accepted into the nursing program, I struggled with diagnosed general anxiety disorder and OCD, which led to moments of depersonalization where things just didn't seem real. I was able to manage this through medication and biofeedback therapy for 2 years. I was doing quite well. January 2020 was my first semester in the BSN program at Douglas College, and 3 months later, the pandemic hit. With the uncertainty of the pandemic and the transition to online classes and being unable to see others, what I had felt before came back, and it left me feeling more alone than ever. In fall of 2020, I was in my second semester of the BSN program, and I attended my first PMP session other than the after-school program we had, special we had in semester 1. During this session, I sat quietly in the background, but the atmosphere of the online session radiated the feeling of a safe space. The PMP coordinators had their cameras on, were sharing their experiences and challenges with the current semester, and they also shared advice on how they were handling the situation themselves. From then on, I attended each of the weekly sessions and eventually became a coordinator in training. Just this past semester, while helping with the semester 1 orientation, a new student asked, "Do you guys have anxiety with all the work we have to do, and do you ever cry?" Without thinking, I helped to answer this question and shared my personal struggles with generalized anxiety and OCD and the medications I was currently taking to help me manage. I had never shared this with anyone besides my 2 of my closest friends, and here I was now sharing this with a group of people who majority of them I had never met in person. After sharing my experience during the session, I felt like a weight I had not even realized I had been carrying had suddenly been lifted. I firmly believe that the safe, supported, and open environment that PMP provided helped me and is still helping me manage and become more open about my mental health, not only with other people, but with my instructors as well, especially during this time of COVID-19. And now Quinn will be talking about how we're reaching out to students during the pandemic.
So you may be asking yourselves, what about the students that don't know about us? How do we help them? How do we provide supports to students who aren't necessarily a part of the group chat or know about us? So we do this by responding to our emails promptly. Our emails are advertised on the Douglas College Student Union website, as well as the Instagram, so that they know about us. And we have one coordinator designated that is responsible for correspondence, and then they field the questions and direct students to appropriate resources from there. As previously mentioned, we also pop into virtual classes and remind students what we are here for, and mention some of the topics for our upcoming sessions to bring in some interest. We also encourage other PMP members to share their knowledge with their peers who do not attend the meetings, thereby encouraging students to act as leaders to their classmates and spread the information about our meetings from word of mouth. So as we are starting to conclude the presentation portion of this interest group, we'd like to share a few meaningful stories that we have experienced with nursing students that really highlights the impact that this type of program has on nursing students of all levels. So a student that was finishing their prerequisites to enter the nursing program reached out to me because they saw on our student union website that there was a peer mentorship program for BSN students. They told me they were feeling anxious and unprepared for their upcoming entry into the nursing program and were wondering if they could join our group to see what nursing school is like. Because of our topics of discussion, such as upcoming exams and clinical preparations, I felt that it might be more overwhelming for them to be part of those discussions when they were not currently part of the BSN program. Instead of turning them away and telling them to come find us when they were accepted into the program, I asked if there was anything specific we could direct them to calm their anxieties a bit. They asked what they should do during the 2-year wait list to be more prepared to come into the nursing program. I took the initiative to collect a few examples of what my peers did during their waitlist time. I compiled a list of a few different jobs and careers that people felt helped them get a leg up in the program and suggested a few topics they could study if they felt so inclined. They were really grateful for the information I gave them and thanked all of us for helping them feel like they were doing everything they could in order to be ready for the nursing program. And Megan will share a few stories next.
Thanks, Quinn. So I actually had a student reach out to our PMP email inquiring about how to proceed with a challenge that they were faced with. The student was experiencing symptoms of a concussion and they were struggling to stay focused and complete assignments and tests. As Quinn knew that I had experienced a concussion during my second semester of nursing school, she thought that I would be the perfect coordinator to provide support and hopefully assist this student navigate this scary time for them. I replied to the student's email suggesting that they reach out to their instructors as well as Mackenzie. I was also able to provide some advice around how I was able to continue with my schooling and manage my symptoms. I then provided them with my personal school email address, just in the event that they wanted further support, as I know that sometimes reaching out to instructors or other faculty members can be a little bit intimidating. The student reached out a second time and seemed very concerned and looking for more of a, can you please just tell me what to do in this situation rather than looking for guidance. In this situation, I was able to set boundaries and maintain within PMP scope by again recommending the student reach out to faculty members who would be able to assist them. And then they could also provide them with any support and extensions that they may need. And then I also shared some of my own lived experiences and insight. The last story I would like to leave with you recently occurred while I was at my first aid course. There were quite a few nursing students from Douglas College in this course. The instructor asked if we knew each other, and I didn't really want to say no because I had a feeling some of the students might have an idea of who I am, as I'm constantly posting in the BSN communication board as well as our WhatsApp groups. So I replied with maybe, and then we kind of just moved on from that and nothing happened. I then, as the course went on, I remember I was sitting there and I could hear these students saying, wow, you're so much shorter than I thought you would be. And I was kind of confused at first. And then I quickly realized that these students just finished their second semester and would have never actually met each other in person unless they had been in the same clinical group. Immediately, my heart ached for these students as I could not imagine what that experience would be like. Shortly after, the student said, "Are you Megan from PMP?" I replied yes, and she was so excited. Although we had never met each other or seen each other in person, we suddenly felt connected and like we had been friends for years. I noticed that as other students were listening to our conversation, I ended up being able to add them to our group chat so that they could get involved as well. It was really special to have this moment with these students, and it really just gave that sense of belonging and community, and it wasn't even on a Douglas College campus. We hope that these stories of our experiences with nursing students leave you with some hope as to how students are able to feel supported and build their community during the isolated times of the pandemic. We are doing all that we can to help future nurses begin their careers in an environment that values mutual growth, positive regard, and encouragement. We will now move on to the paneled questions portion of this interest group, and we will be answering a few prepared questions. So I will pass things along to Charlotte.
Thank you very much, Megan, and thank you very much, panel, for that excellent presentation so far. And I have now 3 prepared questions for you, and I'll give them one at a time. So could you just let me know when you're ready to move on to the next one, please? So the first...
Oh, what? Sorry. Okay. I believe we're ready. Thank you.
Okay. The first one is, what are some lessons that you have learned as coordinators of a peer mentorship program?
So we've definitely learned the importance of setting boundaries in group chats and discussions. So we faced challenges with students frequently reaching out on our group chat at all times of the day and night with questions that couldn't really be answered simply and would lead to further worry and anxiety. So we initiated a time frame as to when this chat could be utilized within working hours, so as not to disturb the many students that are part of the group, and also to respect their home environments by limiting notifications that arrive on our phone at odd hours of the night. We encouraged people with those types of questions to reach out to members of their cohort, professors, or reach out to us Pmp coordinators individually, and to try to hold on to their questions until an appropriate time in the morning. We also had to set group chat boundaries for what questions are appropriate to ask in this type of group. We were receiving questions that sort of challenged academic integrity as our roles as student leaders from this group. We discovered that new students were encountering some difficulties in time management and were looking for methods alternative to completing the assigned readings in order to be prepared for class. We took that time to remind the whole chat about boundaries, reminded them of the academic integrity guidelines of the college, and clarified our roles as coordinators of this group. We're not here to read over assignments or fix up or proofread their papers or tell them that they would be fine in class without doing the recommended pre-work for the classes. We also showed them our support by acknowledging that yes, it is a tough program and there are a lot of readings, but it is possible to do well in your classes, and we are here to support, and we are all in this together. We also shared some of our tips on how to complete the work efficiently and read for content and other time management tips that we've learned from our own academic experience. Another one of the valuable lessons we've learned is how to navigate student support during a pandemic. We initially found it discouraging that we weren't getting the engagement that we had been getting pre-COVID. Less and less people were coming to our meetings, and we didn't really understand why. They're already on their computers, like we didn't comprehend why they didn't want to be on their computer for an extra hour. We just needed to reframe our thinking and kind of came to the realization that even just a handful of students is better than none. Helping just a handful of students is better than helping none. We recognize that a lot of students, ourselves included, were struggling with adjusting to online school, and we were all feeling isolated from our usual study groups and missing seeing our cohort in person. As leaders, we were able to provide one-on-one support to those that reached out to us directly and help guide them through challenges and share our stories with them on how we cope. We are continuously learning about what the students that come to us need, and we've recognized that people are feeling overwhelmed, isolated, and just burnt out. So we started to begin our meetings with check-ins and would go around the group and invited them to share how their week was going and how they were feeling. Students can share whatever they feel comfortable with, but many students take this opportunity to be completely honest in how stressed they are and find that a few minutes of venting helps them relieve some weight they've been carrying around. Many of the students that hear us talk about how exhausted we all are say that they feel relieved that they aren't the only ones feeling run down during online school. Thank you.
Thank you for that answer. Second question is, what are some of the organizational challenges that you have faced?
So we ran into some conflicts while working closely with each other, and while working with our learning community coordinator, Mackenzie, and other senior PMP coordinators, we were able to have virtual meetings to discuss some challenges that we were facing among each other in order to determine how to resolve the situation and work better together in the future. Another thing we accomplished was creating terms of reference. We also added conflict resolution strategies to the PMP handbook to not only assist ourselves with organizational challenges, but also other issues. And when we first moved to an online platform, we found it difficult to organize multidisciplinary events such as the BSN, BSPN collaboration, and employed student nurse info session and regulatory monthly meetings. However, through thoughtfully arranging online meetings where all the PMP coordinators could attend, we were all able to collaboratively overcome these challenges. Thank you.
Thank you for that answer. The final question is, what are the future plans for the peer mentorship program at Douglas College?
Thank you, Charlotte. So I'll address some of the many plans that we have. So some examples of our future plans include developing online recorded workshops for foundational skills, such as reading textbooks for content, note-taking, and professional communication. We are hoping to launch this workshop series for all health sciences students, including academic foundation students, in the fall 2021 semester. In terms of returning to in-person classes, we have plans to reimagine in-person meetings to accommodate COVID-19 protocols. We are also beginning inquiries into reinstating in-person simulations. To enhance our support of mental health, we are considering implementing a regular group counseling session for nursing students with the counseling department, but this is in very early stages. In the future, we would also like to focus on expanding or increasing the support for students who identify as Indigenous. Douglas College has Indigenous services, and Mackenzie can connect students to these services, or we can connect them directly. Next, we are looking into creating a PMP newsletter to share opportunities for BSN program awards and bursaries to ensure that students are aware of how to qualify for awards and bursaries and to get students involved in the process. We would like to also develop a workshop where Douglas College alumni visits to speak about their inspiration to practice and how the college supported their nursing journey and any advice that they can provide to nursing students about their career aspirations. One thing we are always working on is building stamina to support future generations of PMP and planning for continuity as senior members of PMP graduate. Finally, we also wanted to talk to you about the future plans of the colleges and universities that are attending this webinar today. If there is interest, we would love to meet again in the early fall for an interest group webinar where we can discuss the details that go into implementing and managing peer mentorship groups in nursing programs, as well as guidance from faculty leadership and oversight for peer mentorship. We would also love to learn if there are other nursing programs who have their own peer mentorship programs to discuss challenges, solutions to common issues, and opportunities for growth. And I'll pass this back to you now, Charlotte.
Thank you very much, panel. And I will now pass over to Sabiha and Nancy to manage the questions. Thank you.
We would now like to invite questions from the audience. Feel free to raise your hand or to write them in the chat box. I see Nancy wrote, if attendees are interested in a part 2, thoughts, reflections, what you would like to see, please email Nancy Clark at uvic.ca, and that's in the chat box.
We don't have
any.
Okay,
I see. Leah, would you like to ask your question?
Yeah, thank you. So thank you very much for a fantastic presentation. I guess I have a few questions, but I'd also like to express an interest in joining your group. I'm from McGill University, and we actually have had a not PMP, but an NPMP nursing peer mentorship program in existence since 2014. So interestingly enough, a lot of what you've presented, we already have been doing, but we also have another component of mentor-mentee dyad pairing. So I guess there's something that we can exchange and learn from one another. So I'd be interested in being part of that interest group. But I am very curious to know about, as yourselves as coordinators, one, how does one become a coordinator? And two, what is, you were great in defining, Quinn, how it was very important to set limits and boundaries for your WhatsApp. How do you set boundaries between being a coordinator and being a student yourself? Or the rest of the coordinators? I just mentioned Quinn because, so that's a challenge for yourself as well. So where are your boundaries in regards to that?
Yeah, I'm happy to answer this one. As it was sort of mentioned, I'm the sort of representative that answers all the emails, and that can be a bit challenging with balancing my school responsibilities, my academic responsibilities, and my responsibilities as being an active member and responding to emails promptly to know that people are heard and to let them know that they are being listened to. I'm definitely still working it out, but I do try and, you know, schedule some time to do my administrative duties for this program, and definitely put my own education before, you know, emptying myself into the lives of these other people and draining my tank, so to speak. That's how I deal with the boundaries. I just kind of, I don't share anything that I'm not comfortable with. Like Allison shared her beautiful story about how she was comfortable sharing her mental health experiences, but if there's anything that's too sensitive for me or I don't feel comfortable sharing in a large group, I definitely keep that to myself, and that's a good a boundary that I like to keep.
Thanks.
Just to quickly jump into with like the coordinators and how we become coordinators. We kind of basically how it works is that for us as senior coordinators now, we're looking for students who are showing up to meetings, who are showing involvement and who are getting involved. And oftentimes students will either reach out to us and say, hey, how do I get involved in this? Or we'll just notice, for example, Allison and Jesse that are sitting with us now, they were tremendously involved over the past few semesters. So we reached out to them and said, if this is something that the both of you are interested in, we would love to have you on the team. So I feel like as we start to get into the more senior positions, we start looking to kind of find new coordinators that we feel comfortable that would be capable of kind of taking over these roles and jumping in and getting involved.
Thank you.
Nancy, do you want to take the question from the chat box?
Sure. I believe there was someone else that had their hand raised though. And
Jeannie just raised her hand.
Who?
Jeannie. So
okay.
Okay, Jeannie, you can go first.
Matt, oh, thank you. I don't have to go right away, but one of the things I really like your presentation. I think you're doing a fabulous job. And I'm wondering, just given these times and even the experiences you've been talking about, because we've been at Dalhousie University, we've been talking a lot about trauma-informed care. And just wondering if some of your sessions are looking at trauma, because I think more and more we're all needing to use trauma-informed practices. And I find that it really helps when students are able to talk about what's been going on, and all of you have shared such very personal stories and very important. And I think we really need to know, you know, as nurses, as nursing students and whatever, we're all human and we all need to understand what we're going through, because these are very, very challenging times. So just like people's ideas about that. Thank you.
So I can speak a little bit to that. We do try to instill as much as possible trauma-informed practice into our meetings. And one of the ways that we do this is we have a set, I'm not sure what to call it, sort of like a messaging that appears when we start all of our meetings. And that includes our Indigenous Acknowledgement, but it also includes sort of ground rules for the sessions and saying like, this is a safe place. What we discuss here doesn't leave the discussion unless obviously we have their permission. And we just try and make people feel as comfortable as possible. And one of the ways we do that is by disclosing what we're going through too, so that they feel comfortable sharing. So I know Allison talked a little bit about her personal experiences. I've had very similar experiences with the peer mentorship program supporting me and my mental health. And also I felt very comfortable sharing things through this platform. So for example, I've shared that I experience anxiety and depression as well. At one point we had a session specifically for the parents, and unfortunately that one was not very well attended because I think parents are pretty busy and I'm a parent as well. So that has been challenging, but that's something that we talk about as well. And I've talked about a ton of very, I guess, sensitive topics. We've discussed miscarriage support for recurrent miscarriages, mental health support. We've discussed having developing a counseling session. So we have counselors come into our PMP sessions quite often, but we're also discussing having a separate counseling session set up, like a regular weekly session that will be specifically for nursing students, so that we could all join in a safe space where we can discuss what we're going through and have the support of a counselor there as well. So hopefully that answers your question.
Can I also add something to that?
Absolutely.
We also work with the psychiatric nursing students. So we had like a BSN, BSPN collaborative session where we kind of see like what similarities and what differences are, and we kind of take from each other, you know, more of the mental health aspect as well as, you know, medical aspect. But I feel like that really gives us a good insight into you know, the type of things that people could be going through, not just as patients, but as us as students as well, especially right now in the pandemic, because mental health is such an important, well, it was always important, but especially now.
That's great. Thank you very much. That's great. You're doing wonderful, wonderful work.
Thank you, Jeannie and Jennifer and Allison, for that discussion. Linda has a comment who would like to say congratulations and wow, excellent college BSN department. Very proud of you for this presentation. One question that is posted by Linda is, other than Mackenzie, how can faculty and administrators support this group? So, oh, go ahead, Megan.
Yeah, I can jump in. I think that one of the huge supports that we have had, and actually from faculty that are sitting here now, such as Tammy and Ruhina, that have just shared with their students on how their students can get involved. And, you know, telling them when their meetings are and giving those reminders, allowing us to jump into their virtual classrooms during these times. We really don't have a way to get the information out to students other than me sharing in, for example, the group chat or the BSN communication board saying, hey, let's get involved in this. So to have faculty members and to have that connection, giving us opportunities to reach out to students, that's been really huge. So I feel like continuing to do that and just to remind students of how great it is. I think, yeah, I couldn't think of a better way personally, but if anyone else wants to jump in.
One thing that I really like that I just heard from, sorry, I forgot your name already, I'm terrible, from, I think it was from Dalhousie that had the PMP program, that the mentorship dyad sounds really interesting to me, because I've sort of developed some of my own mentorship relationships with some of the instructors during my time at school, usually through like a clinical instructors that I have gotten to know better. But having sort of a formalized mentorship program from faculty to students would be very interesting. And I know that's something that is also very challenging because we have far more students than we have faculty, but it is something that students could perhaps opt into if that's something that they're interested in. And then of course, just any opportunities that you know of for students, whether it's opportunities for scholarships or bursaries or opportunities to get involved in research or to join committees. That sort of stuff is really valuable to students to have on their resumes, and also just to build that experience because a lot of the students are younger and have, they're just starting out their careers. They haven't had a professional career before. So getting that opportunity as a student is extremely beneficial.
So if I can answer Jennifer, I'm from McGill and my name is Leah. So just to let you know, the dyad that we put into place is we have two different types of dyads. So as students are in the program, they can be paired up with a fellow student who is a year older or years older than them. So it's a student to student dyad. And once they've completed our program and they are transitioning to a clinical nurse position, then we provide them the opportunity, if they choose, to be paired with faculty to help them transition. We have multiple programs. We also have another program that exists. So students in their final year of studies are paired up in what we call the Nightingale Fellow Program. They are paired up with clinical clinicians. And it's basically through group mentorship. So we have different programs that are actually in place. And it's, I guess, time sensitive based on where the student is at in their trajectory of their studies and where they're going. So ultimately, that's what we've all developed. But the dyad preparation is really something that we pair, it's a one-on-one. So students fill in an application. We then, the other thing is I am faculty. So I am the consistent, I am the stable person that carries through. And I basically am there to guide and support what we call, you're called coordinators. We have organizing committee, and the students who are interested become part of that. And I work with them to make sure that there's a continuity through the years, or if they are having a question about something, or I'm also the link with faculty. So ultimately, there's that little extra something that allows us to, allows the students to get the support that they need from faculty. And also over the years, the faculty has really learned to value the Nursing Peer Mentorship Program. And so using it in such a way of, can the Nursing Peer Mentorship Program help us with the situation? So it's become over time a win-win for both parties, the students and the faculty, and the school itself basically has definitely profited from this kind of support group.
Thank you.
But
so
if
much.
you need any help, I'd be more than happy to help you develop that process or develop your own process.
Thank you. I really appreciate that. That's a really interesting way to manage the dyads and still have the faculty support towards the end. I really like that, and I'd love to learn more about it. So I'll see if I can get in contact with you, or if we can get in contact with you through the Peer Mentorship Program email. Thanks,
I'll
Leah.
add my email on the chat here, and then feel comfortable to reach out.
Yes, and exactly what Nancy was saying. Maybe we can discuss this more during our part 2 session if we get enough interest in that.
So I see a question here from, sorry, if I don't pronounce this right, but GJ McInnes.
Yeah, hi there. My name is Gloria McGinnis Perry. I'm from University of Prince Edward Island. Thank you all for this great presentation. I'll tell you what the question I have for you all is, I am a psych mental health nurse in almost 40 years when I think about it, and I still feel so young and youthful when I listen to you all and think about me when I started my program and how appreciative I was somebody to help me along, because I didn't want them to know how anxious I was and how ill prepared I was. So I really thank you so much for that. But the question I have for you is, when you become a coordinator, or you're that person chosen, have you ever had an experience where you're being screened in some way, you volunteer, but have you had anyone that really didn't fit the mold to be that that representative, like, just, we talk about boundaries, but also the person knowing their own boundaries and maybe it's not working out. So how do you deal with that if you have? I'm not saying that's something I've dealt with. I'm just kind of curious because there are so many different reasons why people would want to do what you're doing, and altruistic and capable because you're nurses. But every now and then you might get one that may not be. So has that ever happened in your journey?
I can answer this one. We haven't quite experienced something to that level yet, but we have run into a few issues with communication being online. Everyone's messaging, so it's hard to sort of convey tone sometimes. But and it was just kind of a misunderstanding of what level we wanted PMP to be at and the standards that we hold ourselves to. And like we said before, just, really breaking it down and communicating really clearly, it helps to sort of dissipate those miscommunications. But as far as sort of recruiting, we look for the sort of dedicated people who come, like Jesse and Allison are both, there's 4 or 5 of us senior members who are actively mentoring Jesse and Allison currently for them to take over our roles later. So we noticed that Jesse and Allison were both coming to all the meetings, contributing when it was appropriate. Like Allison contributed her mental health experiences during her beginning, when she was beginning to attend sessions. So we really kind of keep an eye out for people who are taking it seriously, attending the meetings with the goal to help people, even though they're not technically coordinators yet, even though they haven't been inducted into the mentorship, So we sort of keep an eagle eye out for people who do express that interest, and they express more and more interest each session. So we're noticing more and more people coming to every meeting and contributing what they can, even though they're not part of the, yeah.
Can I just quickly, oh, sorry, Jen.
Go ahead.
Okay, yeah, I just wanted to say too, I feel like the times that we have come across conflict or kind of reached one of those organizational challenges, that we've definitely all come together as a group. It's never been like oh, you're kicked out kind of a thing. We try to come together, work, and determine how can we all do better in the future. And that's really worked for us in the past. So we definitely kind of take that collaborative approach, and we've had meetings with Mackenzie and other senior coordinators to kind of work through some of those challenges and just make it so that then we can move forward all on the same page, and we can readdress those situations if we need to in future. And then our handbook that we kind of have that lays that out is also a great resource for that.
So you're really applying your effective communication skills on a relational level. And I love what Jeannie said in regards to the whole idea of trauma informed, because, obviously we have no idea where the person's coming from, and always being sensitive. So you're role modeling, what we're looking for those professional qualities, as well as the fact that it's a need. So I really like that. And I hope that you're able to, it would be really neat if someone could publish this in a sense, put your ideas together and, and just articulate it in such a way that you're exemplifying really those professional qualities that we're looking for, using a support group, support program, threads. I think you should share this more so. We have our own element, but not to such extent as you all. So I have some notes, and I hope you don't mind, I'm borrowing them and I'll share them. But like my colleague Kevin said, these are really wonderful qualities that we are constantly looking at and trying to instill and nurture. So maybe you and your classmates, and maybe one of your professors can, get together and put something together so that we can see it and actually get our students to read it as well. Just a suggestion. I don't want more work, but I mean, it's a really, really good topic. It's quite relevant. And we may be naive thinking that everybody knows this, but I've learned some new things, and I've been around the block a few times. So just a suggestion. Thank you all.
Thank you. I just wanted to add one thing to Megan. She covered most of it, but one other thing that we did when we had some conflict arise is that we discussed it, but we also edited our terms of reference. We call it our handbook, but essentially our terms of reference. We updated it to make sure that it included all of our expectations and that the expectations were clearly outlined, and also the expectations for conflict resolution and how we would address any conflicts that arose. We have it formally in a terms of reference for us to refer to if there are other conflicts that come up. So I think that's one of the very important things that we did do when we came across that conflict.
I don't see any more hands up. Nancy, do you see any more questions in the chat box?
I don't, but everyone is just sending huge congratulations. And I think what stands out is just the leadership that the students and staff at Douglas have taken on. And it's just, people are just commenting on that and saying congratulations. I don't see anything else at the moment.
We're at our time, so I think Nancy will give the closing remarks.
Okay, thank you. I would like to acknowledge, first and foremost, the BSN students of Douglas College for their willingness to share their peer mentorship initiative and experience with us. We hope that during this time and in the future that we continue to foster the mental health and well-being of nursing students and faculty. Thank you, Kazan Mental Health Interest Group, Sabaya and Kristen and James for facilitating the presentation today. And a very big thank you to Charlotte, Ross, Mackenzie, Quinn, Megan, Jennifer, Bahar, Allison, Jesse, and Anis for sharing your knowledge, time, and experience with us today. It's very important work. And as we move forward, even beyond the pandemic, mental health will be a paramount issue. It is already globally with disproportionate impacts, especially for those communities that are experiencing discrimination on multiple levels. So again, thank you very much for your work. If you'd like more information, again, I have posted in the chat the Peer Mentorship Program bsn@gmail.com, and or you can contact Mackenzie at mlister1@douglascollege.ca. We really would like to hear more from you, the attendees, your thoughts, reflections beyond our webinar today, what you'd like to see in our future dialogue and implementation of the PMP, if you don't have one already, and how we could learn across the country interesting work that was presented from Leah and Gil as well. So again, thank you very much.